Prostate cancer is being diagnosed at an earlier stage, due in part to the PSA blood test that screens for cancer. Dr. Peter Greenberg of Desert Regional Medical Center in Palm Springs discusses the new treatments for prostate cancer and the success rate when detected early.
The type of patients I see is I don't see anybody who presents with prostate cancer that's already spread to bone or lymph nodes unless they haven't seen a doctor for the last 20 years. And if men are getting their regular routine PSA blood test starting at age 50, the chance of finding prostate cancer at an early stage is extremely good. The nice thing about picking up prostate cancer when it's early is it gives you different options for treatment. If you find the cancer late, it tends to eliminate a lot of the options. So in an early stage patient, let's say we've got a guy who's 65 years old, his primary care doctor has gotten an elevated PSA blood test, sends the patient to a urologist. The urologist does a biopsy of the prostate and confirms that there's prostate cancer. And that gentleman, if he's got a low PSA, if he's got an early stage cancer on the biopsy, he's got three main options. He can either have surgery, which is a radical prostatectomy, have the prostate removed. There's a new thing in surgery called robotic surgery. Other viable options are implantation of radioactive seeds into the prostate or external radiation. And in an early stage patient, most often we're going to be talking with them about a radiation seed implant as being another good option for the patient because it's a way of concentrating the radiation dose in a small area. It's a minimal, non-invasive procedure that doesn't require us opening up the patient. It does require a number of needle sticks to get the radiation seeds into the prostate. But it's another easy way of treating the cancer without actually having to surgically remove the cancer. External radiation works very well as well for early stage patients, but does require coming in for about 42 visits over about 2 months. So from a convenience perspective and from a side effects perspective, the seeds are a little bit easier on patients. The advantage of that particular treatment is you go in the morning for the treatment and you're out in the afternoon, so it's done as an outpatient. And your whole treatment's finished. It takes about an hour to an hour and 15 minutes in the operating room, and you're done. So very nice, easy, slick way to go. Big fears of men is loss of sexual functioning, impotency. And any of the treatments we do for prostate cancer can, on occasion, depending upon the stage of disease and the treatment, can damage the nerves that control sexual functioning. If you can do your treatment so that it has the minimal impact on sexual functioning, for a lot of men that's an important issue, and that's something we talk about at the time of decision making in terms of what type of treatment to do. Other concerns men have is, are they going to lose the ability to hold their bladder? Are they going to be leaking urine? Are they going to be dribbling urine, burning with urination? And again, with the treatments we do for prostate cancer, sometimes those are side effects which are a possibility. Most of the time, in the vast majority of the patients, that's not going to be a problem. And it depends upon what treatment they receive. But again, I'd say the big emphasis is, if we find the prostate cancer early, which we do most of the time now, the chance for having bad symptoms as a result of treatment goes down significantly. Having a PSA blood test, a digital rectal examination at the time of a yearly physical examination is the best way to stay on top of prostate cancer. If you get the PSA done every year, which is how it should be done, if you get a digital rectal exam done every year, the prostate cancer, if you develop it, will be caught at an early time. But it's one of those things that when the patients are going into their physicians, they need to, for their yearly exam, or maybe it's been a little over a year, they need to remind the doctor and just say, hey, listen, are we due for a PSA blood test? Because if you get it done once a year, it'll keep you